Hello, this is Dr. Karen Harum, neurodevelopmental pediatrician, and I'm here today with Vibrant Children to talk to you about healing transformations in autism. This is part of a 6-part blog series, and today we're going to be talking about cow's milk. And in particular, we're going to be talking about cow-derived casein and just what are the problems with cow's milk. Well, let's talk about Nico. Nico is a little boy who experienced chronic upper respiratory infections for the first 4 years of his life. He was on rounds and rounds of antibiotic, and some of the antibiotics required injection for complete treatment. He had also developed chronic belly pain, belly distension, and behaviors that are sometimes classified as autistic. He actually came to me with a diagnosis of severe sensory processing disorder. Well, along his journey, therapists had suggested that he discontinue cow's milk, though there were no obvious signs of cow's milk allergy. To Mom's surprise, Nico improved very significantly with this simple change in his diet. His upper respiratory infection stopped, his belly pain was reduced, and many of his ritualistic and irritable behaviors resolved. So why does cow's milk and the casein protein within it actually result in chronic inflammation, respiratory infections, belly pain, even a condition called neonatal enterocolitis in the neonatal ICU, and abnormal behaviors in some individuals? Why can we associate all of these things with cow's milk? Well, although the answers remain murky, the scientific research is beginning to support what has been known clinically for decades. And if you'll check the written portion of this blog, I have a lot of scientific publications to support the topic that we're talking on today. You see, cow's milk allergy is really difficult to diagnose in children under the age of 2 using traditional skin prick testing for immediate hypersensitivity, or even by measuring the IgE antibody to the cow's milk protein. So it's difficult to measure allergies in children under the age of 2. But there is a different type of test known as leukocyte activation studies, and they are more likely to be positive in cases of true sensitivity because they can be activated by several different immune mechanisms. They don't just rely on the reaction at the skin level. This type of test will pick up sensitivities that traditional allergy testing cannot pick up. And when these sensitivities are present, one may experience vague symptoms of abdominal pain, vague signs of inflammation such as headache, swelling, and even follicular eczema, and behaviors like irritability, insensitivity to pain, hyperactivity, and even mania. So it's important to look for food sensitivities as well as the traditional food allergies. Another problem with cow's milk is the casein type of protein that's within the milk. This fascinating little protein has been widely studied for its role in all sorts of disease. But one mechanism of disease is this. You see, casein, along with some other dietary proteins, are sometimes morphed by the body's chemistry into proteins that bind to the opiate receptors, and they behave a little bit like morphine. Well, this seems to be the mechanism by which casein can cause undesirable behaviors. In fact, some recent epidemiologic studies suggest that an immune reaction to casein is related to the development of schizophrenia and bipolar disorder in adults. Please check those interesting references. Right now, Autism Speaks is funding good clinical research on this issue, and results will soon be available to us to refine our ability to advise the right patients at the right time whether or not to begin a casein-free diet. Remember that if you choose to have your child on a cow's milk-free diet, you will need to add other dietary sources of calcium, including green leafy vegetables, almonds, blackstrap molasses, and broccoli. Substituting almond milk for cow's milk provides an excellent source of bioavailable calcium. Thanks for tuning in today to this blog series on the problem with cow's milk and casein. While I hope that's not a problem in your family, it is a relatively easy one to remedy and may have a huge impact on your child's behavior and overall health. Thanks for tuning in to Vibrant Children today, and I hope that you tune in with us again in this blog series and our upcoming free live webinars. Thanks so much.